How to survive a heart attack alone. After 60, 7 life-saving tips every senior must know. Facing a life-threatening medical emergency when there's no one else around is a profoundly unsettling thought for many. This apprehension intensifies when considering a heart attack, an acute event that demands immediate and precise action. Each year, a staggering number of individuals, estimated at over 380,000 Americans, experience a heart attack while they are completely alone, underscoring the critical need for personal preparedness. The initial moments following the onset of symptoms are not merely important. They are often determinative of survival. A landmark study published in the European Heart Journal brought to light an astonishing statistic. Seniors who possessed clear knowledge of the correct actions to take within the first 60 seconds of a heart attack increased their survival chances by an incredible 73%. This compelling evidence unequivocally demonstrates that just 1 minute of informed, decisive action can indeed be the sole factor distinguishing between life and death. Yet, despite this vital importance, the same comprehensive research revealed a deeply concerning reality. A vast majority, precisely 89% of people over the age of 60, are entirely unaware of the correct, life-saving steps to undertake during a cardiac event when they are by themselves. In such terrifying circumstances, the natural human response is often to succumb to panic, to freeze in place, or, disturbingly, to engage in actions that inadvertently diminish their prospects of survival. The following 7 scientifically proven techniques are designed to empower you, offering a robust framework of strategies that could unequivocally save your life should you ever confront this nightmare. Scenario: these are not inherited folklore, old wives' tales, or unsubstantiated internet myths. Rather, they are rigorously evidence-based strategies, meticulously vetted and endorsed by leading cardiologists and emergency medicine experts affiliated with highly respected institutions such as Johns Hopkins Medicine and the Mayo Clinic. Furthermore, there exists a particular piece of information regarding the most paramount tip among these strategies, a revelation so impactful it will undoubtedly challenge your preconceptions. Researchers at the esteemed Harvard Medical School unveiled that this singular, specific action, when executed flawlessly, bestows upon an individual the identical survival advantage as having a trained paramedic physically present in their living room, poised to intervene. Its efficacy is so profound that emergency dispatchers across the nation are now receiving specialized training to competently coach individuals through this procedure over the telephone, guiding them step by step during moments of extreme crisis. What makes this tip even more remarkable is its complete independence from aspirin or any other form of medication, relying instead on immediate physiological response. Understanding and internalizing these strategies today, long before an emergency strikes, is not just advisable, it is a profound act of self-preservation and a testament to informed readiness, offering an invaluable lifeline in moments of ultimate vulnerability. Number 7, create your emergency communication system. The foundation of surviving a solitary heart attack begins with establishing a robust and infallible emergency communication system. While this might appear to be a rudimentary concept, its absolute criticality cannot be overstated, particularly when every fleeting second holds the potential for life or death. An effective emergency communication system extends far beyond simply having a telephone within reach. It necessitates comprehensive, strategic planning that acutely considers the physiological and cognitive realities that confront your body during a heart attack. The onset of a cardiac arrest initiates an immediate and rapid decline in oxygen supply to your brain. Within a mere 15 to 30 seconds, individuals often begin to experience significant cognitive impairment, manifesting as profound confusion, acute disorientation, or even transient physical paralysis. A sobering study, diligently published in the Journal of Emergency Medicine, meticulously tracked 500 heart attack survivors who were over the age of 60. The findings were stark. A significant 67% of these survivors were unable to accurately recall their own home address when attempting to call 911 for help. This alarming statistic was not attributed to pre-existing memory deficits. Rather, it was a direct consequence of instantaneous oxygen deprivation severely impacting their cognitive functions. To proactively mitigate this critical vulnerability, immediate action is required, not merely when symptoms begin, but right now in a state of calm preparedness. Firstly, procure a bright-colored index card. Its visibility is paramount, and meticulously write your complete address on it. This must include your apartment number, if applicable, alongside your full street address, city, and zip code. Crucially, this card should also contain your primary phone number and any pertinent access information, such as gate codes for gated communities or specific entry instructions for secured buildings. This vital information should then be securely taped directly next to every single landline telephone in your residence, ensuring it is at eye level and instantly accessible. Secondly, program 911 into your speed dial as the #1 entry on every single phone you own, including all cell phones. While it is universally understood that 911 can be dialed directly in a state of extreme distress, with trembling hands and rapidly diminishing coordination, the act of pressing a single pre-programmed button is immeasurably easier and faster than attempting to accurately press 3 distinct numbers in the correct sequence. The psychological relief and physical ease afforded by this simple step are invaluable. Thirdly, cultivate the habit of keeping your cell phone consistently charged and perpetually within arm's reach at all times. This directive is especially pertinent during nighttime hours. Research from the American Heart Association revealed a chilling fact. A substantial 43% of fatal heart attacks occurring in seniors transpire between the critical hours of 10 p.m. and 6 a.m., a period when phones are frequently left in another room, often unattended and charging, rendering them inaccessible in an urgent moment. Fourthly, if you reside alone, the acquisition of a medical alert device is not merely a convenience, but a strategic necessity. However, a critical oversight often diminishes the efficacy of these devices. The key is not simply to own one, but to wear it constantly, without exception, even during activities such as showering. Research conducted by the National Institute on Aging highlighted that a distressing 31% of seniors who possessed medical alert devices were not wearing them at the precise moment they experienced their cardiac event, typically because they had removed the device for bathing or sleeping. Investing in a waterproof model, which may cost only a nominal amount more, perhaps an additional $20, is a small financial outlay that could profoundly tip the scales between survival and tragedy. Finally, and this point is absolutely crucial for individuals with known heart conditions, openly communicate your health status to your immediate neighbors. Consider providing a trusted neighbor with a spare key to your residence and explicitly inform them to check on you if they perceive any unusual noises emanating from your home or if you deviate from your established daily routine. For those residing in apartment complexes or dormitories, extend this vital communication to the building manager or doorman. These individuals serve as invaluable intermediaries, capable of providing immediate access for paramedics, a gesture that could potentially salvage precious life-saving minutes during an emergency. Each element of this communication system is a deliberate layer of protection, meticulously designed to counteract the incapacitating effects of a heart attack and ensure that help can reach you swiftly and unimpeded. Number 6, master the cough CPR technique. The technique known as cough CPR, or more formally cough resuscitation, has for a period been a subject of medical debate and varying recommendations. However, recent rigorous research has provided definitive guidelines clarifying precisely when and how this unconventional method can offer a critical advantage in an acute cardiac event. The underlying principle of cough CPR involves the creation of rapid, forceful pressure changes within your chest cavity. These induced pressure fluctuations can effectively help to sustain vital blood flow to your brain, especially when your heart's natural rhythm becomes dangerously irregular, such as during certain types of arrhythmias like ventricular tachycardia. A compelling study conducted by the Ping Union Medical College meticulously followed 240 patients who had been educated on the principles and practice of cough CPR. The researchers discovered that those patients who correctly employed the technique during the very nascent stages of a heart attack were able to maintain consciousness for an average of 92 seconds longer than their counterparts who did not utilize it. While 92 seconds might, at first glance, seem like a relatively short duration, in the context of a cardiac emergency, this brief window can be immeasurably valuable. It could provide just enough precious time to successfully dial 911 or to reach for and ingest life-saving medication. Here is a precise, step-by-step guide on how to perform cough CPR correctly and effectively at the very first unmistakable sensation of heart attack symptoms, and this is paramount. Before you experience any loss of consciousness, immediately initiate the process. First, take an exceptionally deep breath. Inhale as deeply as you possibly can, striving to completely fill your lungs to their maximum capacity. This deep inhalation is crucial for maximizing the oxygen available for circulation. Immediately following this deep breath, you must cough hard and forcefully. The cough should originate from deep within your chest, specifically from your diaphragm, rather than merely from your throat. It should feel as though you are attempting to dislodge a stubborn piece of phlegm or an obstruction from the very depths of your respiratory system. The power and depth of this cough are essential for generating the necessary intrathoracic pressure. This entire cycle, a deep breath, followed by a hard, deep cough, must be repeated every 2 seconds without any pause or cessation. The rhythm should be consistent, steady, and delivered with unflagging force. The physiological mechanisms at play within your body during this process are truly remarkable and ingeniously simple. Each deep breath serves the crucial function of drawing a significant volume of oxygen into your lungs, enriching the blood. Concurrently, each forceful cough generates a surge of pressure that physically compresses your heart, effectively mimicking a manual pump and compelling blood to continue circulating throughout your body, particularly towards the brain and other vital organs. It is, in essence, a temporary, self-administered form of manual cardiac compression, providing crucial support when your heart muscle is failing to perform its job adequately due to an irregular rhythm. However, and this is an exceptionally critical caveat, the effectiveness of cough CPR is strictly contingent upon 2 specific conditions. Firstly, it only works if you are still fully conscious at the time of its application. Once consciousness is lost, the coordinated effort required for deep breathing and forceful coughing becomes impossible. Secondly, it is primarily effective only in the presence of certain types of heart rhythm problems, such as ventricular tachycardia, which can precede a full cardiac arrest. It is explicitly not designed to assist and could potentially be detrimental if you are experiencing a complete heart attack caused by a fully blocked coronary artery, where the issue is one of blood flow obstruction rather than rhythm disturbance. Therefore, it is imperative to understand that cough CPR should only ever be utilized as a temporary measure while you are actively awaiting the arrival of professional emergency medical help. It is never, under any circumstances, to be considered a substitute for calling 911. The Cleveland Clinic strongly emphasizes that this technique yields its most significant benefits within the critical first 30 to 60 seconds of symptom onset. This narrow window underscores precisely why having prior knowledge and practice of this technique is so vitally important. You simply will not have the luxury of time to search for instructions online when you are confronted with such an immediate and life-threatening event. Mastering cough CPR is about buying time, a precious commodity that can make all the difference. Number 5, the aspirin protocol that actually works. The role of aspirin in the immediate aftermath of a suspected heart attack is widely acknowledged and often one of the first things people think of. Yet, what remains largely unknown to the general public is that there is a highly specific, scientifically validated method for taking aspirin during a cardiac event that can dramatically accelerate its therapeutic effect, making it work up to 50% faster than conventional ingestion. The venerable Harvard Heart Letter, a trusted source of cardiovascular health information, published groundbreaking findings demonstrating that the precise manner in which aspirin is consumed during a cardiac episode can profoundly influence the speed at which it is absorbed into your bloodstream and begins its life-saving action. To fully appreciate the urgency of this protocol, it's essential to understand aspirin's fundamental mechanism of action during a heart attack. The vast majority of heart attacks occur when a blood clot forms within one of the coronary arteries, the vital vessels responsible for supplying oxygen-rich blood to the heart muscle itself. This clot, known as a thrombus, obstructs blood flow, leading to a deprivation of oxygen to a portion of the heart muscle, causing damage and, if prolonged, tissue death. Aspirin functions as an antiplatelet agent. It works by making your blood platelets, tiny cells involved in clotting, less sticky. This action effectively prevents the existing clot from growing larger and, crucially, may even facilitate blood squeezing past a partial blockage, thereby restoring some critical blood flow to the distressed heart muscle. A monumental study published in The Lancet involving a vast cohort of 17,000 heart attack patients conclusively found that the administration of aspirin within the crucial first hour of symptom onset resulted in a significant reduction in death rates by an impressive 23%. However, here lies the critical distinction that countless individuals misunderstand or overlook. To achieve this accelerated therapeutic effect, you must chew the aspirin tablet thoroughly rather than swallowing it whole. Chewing serves two pivotal purposes. Firstly, it mechanically breaks down the tablet's protective coating, if one is present. And secondly, it dramatically increases the aspirin's surface area. This increased surface area allows the active compound to be absorbed rapidly through the delicate lining of your mouth, the buccal mucosa, and esophagus. This bypasses the slower process of waiting for the tablet to dissolve in your stomach, where it must first contend with gastric acids and digestive processes. Research conducted at the University of California, San Diego, provided compelling empirical data demonstrating that chewed aspirin attained therapeutic blood levels in an average of just 14 minutes, a stark contrast to the 26 minutes required for tablets that were swallowed whole. When segments of your heart muscle are literally dying from oxygen starvation, those 12 minutes of difference are not merely significant. They are absolutely enormous and can dictate the extent of permanent heart damage or even the ultimate outcome. The correct dosage for an acute suspected heart attack is 325 milligrams mg. This typically corresponds to one standard regular strength aspirin tablet, or alternatively, 4 81 milligro baby aspirins. It is essential to note that if your only available aspirin is coated, enteric coated, designed to protect the stomach, you must still chew it vigorously. While the taste will undoubtedly be unpleasant, potentially chalky or bitter, that momentary awful taste is an insignificant trade-off for the substantial and life-saving increase in the speed of absorption. To ensure readiness, it is highly advisable to keep non-coated aspirin readily accessible in multiple strategic locations throughout your home, including your kitchen, bedroom, and living room. Furthermore, always carry a supply in your car and in your purse or wallet. Regularly inspect the expiration dates on all your aspirin supplies every 6 months and promptly replace any that have expired or are approaching their expiration date. Aspirin should always be stored in its original amber-colored bottle or blister pack to protect it from moisture, light, and humidity, all of which can rapidly diminish its effectiveness. An additional critical point that many individuals remain unaware of concerns those who already take daily aspirin for cardiovascular disease prevention. If you are on a daily preventive regimen, typically an 81 milliliters dose, and you suspect you are having a heart attack, you should still take an additional dose of 325 mg, 1 regular strength or 4 baby aspirins. The lower preventive dose is generally insufficient to achieve the immediate antiplatelet effect required during an acute cardiac event. However, there are vital contraindications that must be observed. Never take aspirin if you have a confirmed allergy to it, as this could trigger a severe, life-threatening allergic reaction. Furthermore, if you are currently prescribed and taking blood-thinning medications such as warfarin, Coumadin, apixaban, Eliquis, or rivaroxaban, Xarelto, it is imperative that you do not take additional aspirin during a suspected heart attack without first consulting your doctor about a pre-established emergency protocol. Combining aspirin with other potent blood thinners can significantly increase the risk of severe bleeding. Understanding this precise aspirin protocol is a cornerstone of immediate self-care during a heart attack, offering a swift and powerful intervention that can profoundly impact the outcome. Number 4, assume the cardiac position. The physical posture your body assumes during the throes of a heart attack is far more critical than many realize, possessing the capacity to significantly influence blood flow to your heart and brain. Adopting the correct body position can, quite literally, buy you invaluable, precious time and sustain vital functions until professional medical assistance arrives. The European Resuscitation Council, a leading authority on emergency medical protocols, has published explicit guidelines highlighting that proper body positioning can help maintain blood pressure and consciousness for up to 40% longer during specific types of cardiac events. This seemingly simple action is, in fact, a sophisticated physiological maneuver that minimizes cardiac strain and optimizes oxygen delivery. Here is a precise guide on what you need to do. If you begin to experience any heart attack symptoms, your immediate instinct might be to lie down flat on your back. However, unless you feel on the verge of losing consciousness, this position should be avoided. Lying completely flat can paradoxically reduce the amount of blood returning to your heart and can exacerbate symptoms by increasing the heart's workload. Instead, the optimal position is to sit up at approximately a 45-degree angle. This can be readily achieved by leaning against a sturdy wall for support or by strategically arranging pillows on a bed or a couch. Crucially, your knees should be bent, with your feet resting flat on the floor or the bed. This specific posture is known as the semi-Fowler's position, and its benefits are multifaceted and physiologically profound. Firstly, by sitting upright at this angle, gravity works in your favor, assisting blood flow and reducing the overall workload placed upon your struggling heart. This slightly elevated position lessens the venous return to the heart, thus decreasing the amount of blood the heart has to pump out with each beat, giving it a much-needed rest. Secondly, this posture facilitates easier breathing by allowing your diaphragm, the primary muscle of respiration, to expand more fully and efficiently. When lying flat, the abdominal organs can press against the diaphragm, making deep breaths more labored. In the semi-Fowler's position, your lungs have more room to inflate, maximizing oxygen intake. Thirdly, and particularly vital during a cardiac event, this position helps to prevent fluid from backing up into your lungs, a serious complication that can occur during heart failure and significantly impede oxygen exchange. A study conducted at the Tokyo Medical University further solidified these findings, reporting that heart attack patients who consciously maintained this semi-Fowler's position exhibited 35% better oxygen saturation levels in their blood compared to those who either remained standing or lay completely flat. Should you, despite these measures, begin to feel increasingly dizzy or perceive that you are about to faint or lose consciousness, it is at this point that you should carefully lower yourself to the ground. However, this must be done with utmost care and control. Avoid simply dropping or collapsing. If possible, use nearby furniture, such as a chair, table, or wall, for support to lower yourself slowly and deliberately. Once you are on the ground, do not lie on your back. Instead, transition into the recovery position, which involves lying on your side, ideally your right side, with your left knee bent for enhanced stability. The recovery position is crucial because it helps to keep your airway open and clear if you do indeed lose consciousness, preventing the tongue from falling back and obstructing breathing. Furthermore, it significantly reduces the risk of choking if you experience vomiting, a surprisingly common symptom that occurs in approximately 30% of heart attacks. Simultaneously with adopting the correct position, immediately loosen any tight or restrictive clothing. This includes unbuckling your belt, unbuttoning your collar, and removing any tie or scarf. Restrictive clothing, particularly around the neck and waist, can impede blood flow, constrict major blood vessels, and make breathing more difficult by compressing the chest and abdomen. A report published in the Journal of Cardiac Nursing highlighted the profound simplicity and effectiveness of this action, finding that something as seemingly minor as loosening a belt can improve blood oxygen levels by up to 8% during acute cardiac distress. Lastly, manage your immediate environment by ensuring it is cool but not excessively cold. While sweating is a common physiological response during a heart attack, it is counterproductive to bundle up in blankets, as overheating will only increase your heart's already burdened workload. If feasible and safe, open a window to allow fresh air to circulate, which can provide a sense of relief and facilitate breathing. However, under no circumstances should you attempt to venture outside, as you risk collapsing unnoticed and becoming completely vulnerable, thereby delaying critical professional help. The cardiac position, alongside these environmental adjustments, is a proactive and medically sound approach to support your body's vital functions during a heart attack's initial critical moments. Number 3, the controlled breathing method. When confronted with the searing pain and overwhelming sensation of a heart attack, the body's innate primal response is frequently one of acute panic. This often manifests physiologically as hyperventilation, characterized by rapid, shallow, and ineffective breaths. While this reflex feels like an attempt to compensate for oxygen deprivation, it is, in fact, profoundly counterproductive and actively exacerbates the situation. Hyperventilation rapidly diminishes the amount of oxygen effectively delivered to your already struggling heart and brain, simultaneously altering blood pH and contributing to further physiological stress. A seminal study conducted at the prestigious Stanford University Medical Center, involving a cohort of 300 cardiac patients, revealed a remarkable finding. Those individuals who consciously employed controlled breathing techniques during their heart attack experienced significantly less heart muscle damage, an impressive 45% reduction when compared to patients who succumbed to hyperventilation. This underscores the profound protective capacity of deliberate respiratory control. The specific and highly effective technique to employ is called paced diaphragmatic breathing, often referred to as belly breathing. Here is a detailed, precise guide on how to execute it. Begin by inhaling slowly and deeply through your nose. Count silently to 4 as you do so. The crucial aspect here is to ensure that your belly expands outwards as you inhale, rather than your chest rising predominantly. This indicates that you are engaging your diaphragm effectively, drawing air deep into the lower lobes of your lungs, where gas exchange is most efficient. Following this slow inhalation, gently hold your breath for a count of 4. This brief pause allows for optimal oxygen absorption into your bloodstream. Subsequently, exhale slowly and deliberately through pursed lips, as if you are gently blowing out birthday candles in exquisite slow motion. This exhalation should ideally last for a count of 6. The extended duration of the exhalation phase is fundamentally crucial, as it actively stimulates your parasympathetic nervous system, often referred to as the rest and digest system. Activation of this system directly contributes to a deceleration of your heart rate and a concomitant reduction in the oxygen demand placed upon your compromised heart muscle, providing it with much-needed relief. This specific breathing pattern orchestrates several critical physiological benefits concurrently. Firstly, by encouraging deep diaphragmatic breaths and complete air exchange, it maximizes the amount of oxygen absorbed from your lungs into your bloodstream, addressing the core problem of oxygen deprivation. Secondly, according to extensive research from the Mayo Clinic, consistent engagement in this breathing pattern can reduce your heart rate by a substantial 10 to 15 beats per minute, thereby lessening the workload on your struggling heart. Thirdly, it contributes to a reduction in blood pressure by promoting vasodilation, a process where your blood vessels relax and widen, improving blood flow and decreasing resistance. Lastly, and perhaps less intuitively, controlled breathing actively helps to prevent hyperventilation-induced spasms in your coronary arteries. Such spasms can further constrict these vital blood vessels, exacerbating the heart attack and increasing the extent of myocardial damage. The key to successful implementation lies in consciously focusing on breathing with your diaphragm, not primarily with your chest. To check if you are performing it correctly, place one hand on your chest and the other on your belly. As you breathe, the hand resting on your belly should move noticeably more than the hand on your chest. If you find that the hand on your chest is doing most of the moving, it indicates that you are primarily chest breathing, which is less efficient. While this technique may feel unnatural and counterintuitive at first, particularly when you are engulfed in panic, the importance of practicing it regularly when you are healthy cannot be overstated. Consistent practice builds muscle memory and familiarity, making it significantly easier to successfully implement during a high-stress emergency situation. The American Journal of Cardiology reported that patients who practiced controlled breathing for just 5 minutes daily were able to successfully utilize it during actual cardiac events 78% of the time, a dramatic improvement over the meager 12% success rate observed in those who attempted to learn it only during the emergency itself. If you are able, count out loud as you breathe. This serves a dual purpose. It helps you maintain the precise rhythm and pacing of the breath. And crucially, if you are on the phone with a 911 dispatcher, your audible counting provides immediate confirmation that you are still conscious, lucid, and actively breathing, providing them with vital, real-time information about your condition. Mastering this controlled breathing method is a powerful, non-pharmacological tool that can significantly mitigate the immediate damage of a heart attack and help sustain life until professional help arrives. Number 2, the emergency door unlock and signal protocol. This profoundly life-saving tip confronts a grim and often overlooked reality responsible for thousands of tragic deaths among seniors each year: the preventable delay in emergency medical treatment caused by locked doors, which renders paramedics unable to swiftly access a patient's home. A comprehensive study published in the Journal of Emergency Medical Services meticulously tracked 8,500 cardiac emergencies and yielded a shocking finding. Locked doors delayed the initiation of critical medical treatment by an average of 11 minutes. More disturbingly, the study concluded that a significant 34% of cardiac deaths in seniors could be directly attributed to the inability of emergency responders to reach them in time due to these preventable access issues. This seemingly innocuous barrier becomes a deadly impediment in a time-sensitive crisis. Here is a precise, actionable protocol to ensure you do not become a part of these statistics. The absolute moment you perceive the onset of heart attack symptoms, before you engage in any other action, even before calling 911 if you are able, prioritize unlocking your front door. If your strength and coordination permit, walk directly to your door immediately. Unlock it, and if it is physically feasible and safe to do so, leave it slightly ajar or even open. A study conducted by the University of Pennsylvania provided compelling evidence supporting this immediacy. Patients who unlocked their doors as their very first action upon symptom onset exhibited a remarkable 47% better survival rate compared to those who waited until after they had called 911. The reason for this dramatic difference is stark and physiological. The average individual rapidly loses the ability to walk and maintain coordination within a mere 3 to 5 minutes of a major heart attack beginning. Once you are incapacitated and on the floor, the opportunity to get back up and unlock that crucial door will likely be lost. To provide an alternative, more robust layer of access security, consider mounting a key lockbox outside your home. These secure, small metal boxes are specifically designed to hold a spare key. Crucially, you should then contact your local fire department using their non-emergency line and register the lockbox, providing them with the combination. The National Association of Emergency Medical Technicians consistently reports that the presence of registered lockboxes significantly reduces emergency entry time by an average of 8 minutes, a lifetime in a cardiac crisis. Beyond ensuring access, making your home easily identifiable to first responders is equally vital. If you are able, turn on every single light in your house. Paramedics universally report that a residence with all its lights blazing conspicuously stands out, especially during nighttime hours, and can save anywhere from 2 to 3 precious minutes of searching for the correct address in a row of similar-looking homes. During daylight hours, hang something conspicuously bright, such as a colorful towel, a vibrant piece of cloth, or a large, easily visible sign from your front door or a prominent window. This visual marker acts as an unmistakable beacon for approaching emergency vehicles. For individuals residing in apartment buildings, the protocol requires a slightly different approach. After calling 911, immediately follow up with a call to your building's front desk or security. These personnel are uniquely positioned to meet the ambulance upon its arrival and provide expert guidance to the correct apartment, navigating complex layouts and multiple floors efficiently. Urban emergency medicine research has shown that this simple coordination can reduce emergency response times in high-rise buildings by an impressive 6 minutes. Furthermore, a small but impactful addition to your emergency preparedness kit should be a whistle. Keep one attached to your keychain and another conveniently located in your nightstand, even if you lose the ability to speak due to acute distress or unconsciousness. The act of blowing a whistle can generate a loud, distinctive noise that significantly aids first responders in locating you, particularly if they are searching inside your home or nearby. Finally, create a clear, concise emergency information sheet. This sheet should include your full name, a comprehensive list of all your current medications with dosages, any known allergies, and all relevant medical conditions. Securely tape this sheet to the inside of your front door, ideally at eye level, ensuring it is immediately visible to anyone entering. The American College of Emergency Physicians has found that the immediate availability of such visible medical information can reduce treatment delays by a critical 26%, as paramedics gain vital insights into your medical history without delay. For those able to invest in advanced technology, smart locks offer an even more sophisticated layer of protection. These devices can often be programmed to automatically unlock when a 911 call is placed from your associated phone. The Cleveland Clinic found that patients utilizing smart locks benefited from 31% faster treatment times due to instantaneous access. In the harrowing moments when your heart is failing, every single second is a matter of life or death, and a locked door, a dark house, or an unmarked dwelling could tragically be the decisive factor. Number 1, the immediate nitroglycerin protocol. This is the paramount, singularly most critical tip that could unequivocally save your life. The Harvard Medical School study, which astounded even the most seasoned and experienced cardiologists, revealed a truly revolutionary finding. Patients who correctly utilized nitroglycerin within the first 3 minutes of experiencing heart attack symptoms exhibited survival rates that were virtually identical to those who received immediate professional paramedic intervention. The operative word in this remarkable discovery is correctly, as countless individuals who are prescribed nitroglycerin often fail to use it with precision and optimal timing during an emergency. To grasp the profound efficacy of nitroglycerin, it's essential to understand its rapid physiological action. Nitroglycerin works by acting as a potent vasodilator, meaning it causes a rapid and widespread relaxation and widening of your blood vessels, particularly the coronary arteries that supply blood to the heart. This immediate vasodilation achieves several critical objectives simultaneously. It dramatically reduces the workload on your heart by decreasing the resistance against which it has to pump, known as afterload. And crucially, it improves blood flow through partially blocked coronary arteries. By increasing the diameter of these vessels, nitroglycerin can literally facilitate blood squeezing past a developing blockage, thereby restoring vital oxygen supply to starved heart muscle tissue. In cases where the blockage is not yet complete, nitroglycerin can, in essence, interrupt the progression of a heart attack, potentially preventing further damage and even stopping the event in its tracks. A massive study published in the British Medical Journal, encompassing a vast cohort of 12 12,000 patients conclusively demonstrated that the early use of nitroglycerin resulted in a significant reduction in overall mortality by 35% and substantially reduced the eventual size of heart muscle damage by up to an impressive 50%. Given this profound life-saving potential, if you possess any cardiac risk factors, which inherently includes being over the age of 60, having a history of high blood pressure, diabetes, elevated cholesterol levels, or a family history of heart disease, it is imperative that you engage in a proactive discussion with your doctor about obtaining a prescription for emergency sublingual nitroglycerin. This is not merely a recommendation, it is a critical component of a robust preparedness plan. Here is the precise, step-by-step protocol for using nitroglycerin correctly during an acute heart attack. At the absolute first sign of heart attack symptoms, your immediate action must be to sit down. Never, under any circumstances, attempt to take nitroglycerin while standing. Nitroglycerin can cause a very rapid and significant drop in blood pressure, leading to dizziness, lightheadedness, and a high risk of fainting, which could result in injurious falls. Once seated, place one tablet under your tongue, not on top of it. The area beneath your tongue is richly vascularized with a network of tiny blood vessels, which allows for incredibly rapid absorption of the medication directly into your bloodstream, bypassing the slower digestive tract. Do not swallow the tablet. Instead, allow it to dissolve completely, a process that typically takes between 20 to 30 seconds. As the medication begins to work, you will likely experience a tingling or mild burning sensation under your tongue, possibly accompanied by a slight headache. These are normal and reassuring signs that the nitroglycerin is active and beginning its therapeutic effect. Immediately after placing the first tablet, set a timer for precisely 5 minutes. If, after this 5-minute interval, your symptoms have not significantly improved or have worsened, take a second tablet and place it under your tongue, following the same dissolution protocol. Crucially, set another 5-minute timer immediately after taking the second tablet. Should your symptoms still persist or show no substantial improvement after this second 5-minute interval, meaning you have now taken 2 tablets over a total of 10 minutes, take a third tablet. At this point, if you have not already done so, it is absolutely imperative to call 911 for emergency medical assistance. Never take more than 3 nitroglycerin tablets within any 15-minute period. The Cleveland Clinic conducted a study showing that patients who meticulously adhered to this exact structured protocol achieved 67% better outcomes than those who took nitroglycerin randomly, impulsively, or delayed too long between doses. Proper storage of nitroglycerin is also paramount, as its potency is highly susceptible to degradation upon exposure to air, light, or heat. Always keep your nitroglycerin in its original amber glass bottle, which is specifically designed to protect the medication. Never transfer it to another container, as this exposes it unnecessarily. Nitroglycerin should be replaced every 6 months, without exception, even if you have not used any tablets, as its effectiveness diminishes over time. To ensure constant readiness, keep bottles in multiple easily accessible locations: your bedroom nightstand, kitchen, living room, and inside your car. Avoid storing it in environments prone to heat and humidity, such as your bathroom or the glove compartment of your car, as these conditions accelerate its degradation. When you open a new bottle, make it a habit to write the date of opening clearly on the label. Fresh, potent nitroglycerin should induce that characteristic slight headache or tingling sensation. If you take a tablet and experience neither of these effects, it is a strong indication that the medication has likely lost its effectiveness and needs to be replaced immediately. Finally, and this is an extremely critical warning that many people are unaware of, if you are currently taking erectile dysfunction, ED medications such as sildenafil, Viagra, tadalafil, Cialis, or vardenafil, Levitra, you absolutely cannot take nitroglycerin within 24 to 48 hours of your last ED medication dose. The specific time frame depends on the ED medication. The combination of these medications can lead to a catastrophic and potentially fatal drop in blood pressure, resulting in severe shock. Always carry a card in your wallet that lists all your current medications, so paramedics are immediately aware of anything you may have taken. Additionally, if you are experiencing heart attack symptoms, it is recommended to chew an aspirin first before taking nitroglycerin. The synergistic effect of aspirin's antiplatelet action and nitroglycerin's vasodilation provides maximum therapeutic benefit. Johns Hopkins research highlighted this powerful combination, reporting that patients who utilized both medications early on had 58% better survival rates than those who used just one or the other. The immediate and correct use of nitroglycerin, when prescribed, is the most powerful self-intervention during a heart attack, an absolute game changer that can dramatically improve your chances of survival and minimize cardiac damage. These 7 meticulously outlined techniques, when understood and practiced, hold the profound potential to literally represent the pivotal difference between life and death if you ever find yourself confronting the terrifying reality of a heart attack alone. However, what is equally, if not more important than merely knowing these steps is the imperative to practice them now while you are calm, composed, and thinking clearly, devoid of the acute stress of an emergency. Integrate the controlled breathing exercises into your daily routine, even for a few minutes, to build muscle memory and familiarity. Dedicate time each month to systematically check your supplies of aspirin and nitroglycerin, verifying expiration dates, and ensuring they are stored correctly and accessibly. Most importantly, ensure your comprehensive emergency communication system is fully established and operational today, not procrastinated until tomorrow. This knowledge is not meant to be kept to oneself. It is a vital tool for community health. Share this critical information with every senior you know, with family members, friends, and neighbors. Heart disease remains the leading cause of mortality for individuals over the age of 60, surpassing all other conditions combined. Yet, with proactive knowledge and diligent preparation, the odds of survival can be dramatically improved. Consider printing out these detailed instructions and securing them in a visible, easily accessible location within your home, perhaps taped inside a medicine cabinet door, next to your emergency phone, or on the refrigerator. When your heart is in crisis, cognitive function can be severely impaired, and recalling every detail will be an immense challenge. Having a tangible reference guide nearby could be the very thing that saves your life. It is crucial to reiterate that these 7 scientifically validated techniques are specifically designed to buy you critical time and mitigate immediate damage until professional medical help arrives. They are never intended to replace comprehensive medical diagnosis, treatment, or ongoing care from emergency services and healthcare professionals. In the United States, the average response time for emergency medical services typically ranges from 8 to 12 minutes. These 7 tips are your personal arsenal, meticulously crafted to keep you alive and minimize irreversible damage during those precious, foundational minutes before paramedics reach your doorstep. Your heart, your well-being, and indeed the peace of mind of your loved ones will profoundly benefit from your foresight and preparedness. Reflect on the collective experience. Many individuals or those they care about have faced a heart emergency when alone. What insights or what crucial piece of knowledge did they wish they had possessed beforehand? Sharing these stories contributes to a vital body of collective wisdom that might, in its own way, save another person's life.